So the care of emphysema prior to valves, we had very, very limited options. We had the usual inhaler bronchodilators, inhaled corticosteroids, and systemic corticosteroids that were used, a few other drugs that came in to play with the goal of bronchodilation. Oxygen has always been there to support some function, but that did not really improve a lot in terms of quality of life and so on. It did help with survival though.
And so what happens with COPD and emphysema is that they get a lot of air trapping. They become breathless because they just can't bring in the air. They also can't get the air out. And what the Zephyr valve procedure is a bronchoscopy is performed that implants these little one-way valves into the airways and allows the lung to decompress or collapse. And we're targeting areas of lung that are severely damaged by the emphysema. What studies have shown with this valve is it relieves patients' shortness of breath. It improves their quality of life in that they're able to walk farther and have less symptoms due to their COPD.
If we look at the last 2 decades leading up to Zephyr valve, all of that has been prologue to today, where we actually have a minimally invasive treatment for severe emphysema. Taking the hyperinflated and least functional parts of the lung, placing one-way valves to reduce the hyperinflation. It actually causes those to deflate, allowing the diaphragm to move to a much more optimal physiologic form to improve breathing and reduce the amount of work of breathing. One thing I'll say that has really changed my perspective on interventional pulmonology in general is that my job up until placing Zephyr valves has really been focusing on the diagnosis and treatment of lung cancers and the treatment of post-transplant patients. The ability to actually place Zephyr valves and have patients wake up immediately feeling much better has really given me a sense of accomplishment, and it's much more satisfying to me.